So what treatment typically involves for OCD are gradual, careful exposure to people's OCD fears. That's what seems to kind of be most effective. So the kinds of therapies that we have are exposure and response prevention, or cognitive therapy. And exposure and response prevention really involves working with the person experiencing OCD, very gradually supporting them to face their OCD fears, such as, let's say, leaving the house without checking the front door repeatedly. Acknowledging that can feel anxiety-provoking, but supporting the person to stay with those feelings of anxiety, notice how those feelings of anxiety do tend to fade by themselves. And then what we find is, for most people, is over time, is the compulsion to go back and check becomes less and less, until hopefully the person begins to overcome OCD. And that way of working with OCD does actually seem to be effective for maybe about 2/3 of people with OCD, which is fantastic. It also means there are about 1/3 of people where maybe this form of therapy isn't so effective.